Now, I've talked about other different aspects of Alzheimer's disease, but this kind of puts it into a little different category for you. Some of the things I've said before, some of the things may be a little different. Now, when you talk about the 10 warning signs of Alzheimer's disease, again, I mentioned Alzheimer's disease is one of the dementias. Dementia's the big umbrella. Alzheimer's disease is 65% of all dementias. Now, when you talk about the 10 warning signs, the first one would be memory loss. Very common warning sign for Alzheimer's disease. What happens with memory loss? The person begins to forget things. They may forget what they had for breakfast, for what they had for dinner. They may forget to pay the phone bill. They may forget to pay the light bill. But they begin to forget things. They may lose their keys. They may begin to forget things. One of the most common signs of Alzheimer's disease is they forget things. Now, when they do begin to forget things, it's a warning sign. So maybe you need to have them checked out. Next, they may have difficult time for performing familiar tasks, such as preparing a cake. All the different ingredients, you have to do it in order many times. Several different ingredients have to go into the cake. Well, if they're having a challenge with their memory, they may have a challenge in doing a familiar task, such as preparing a cake. Thirdly, problem with language. They may know what they want to say, but they can't really get the word out. They may ask you for a fork where they really want the knife. They may describe the couch where they're describing a chair. Well, you know that thing you sit in, that thing that has the arms on it, that thing, you know what I'm talking about. They may say something like that, where really they just want to say the reclining chair. Next, they may be disoriented to time and place. Now, what does that mean? That means, say they used to work a night shift, and they haven't done that for 15 years. This morning they get up, they put on their clothes, they're getting ready to go out the door. It's 3 o'clock in the morning. You see them fully dressed. You say, where are you going? They say, I'm going to work. Well, disoriented to time and place. Another component is inability to concentrate on tasks, which is why it becomes difficult to do a task that has more than one step. Very, very common. If you have a task that has multiple steps involved with it, they may not be able to do it anymore. Challenges in personality. They may become irritable at simple things that they used to be just fine with. They may have a personality that used to be very calm, cool, and collective, and now they're uptight about the simplest thing. They may have a personality that used to be upset about everything, and now they're calm, cool, and collective. It's a change. You're looking for changes in their personality, which is what would suggest maybe Alzheimer's disease or some type of dementia. Loss of interest in activities that they're used to doing. Say they like to play chess, they like to play checkers, they like to take pictures. And they don't have much of an interest. Hey, do you want to go out and take some pictures? Nah, I don't want to do that today. Want to play a game of chess? No, I don't want to do that today. Again, something that they used to like to do, they no longer have an interest in. If you never liked to play chess in the first place, well, that wouldn't apply to you. Problems with abstract thinking. Abstract thinking is, for example, if I say to you, if you live in a glass house, you should not throw stones. And then I would say, what does that mean? And a person with Alzheimer's disease might say, you'll break the house. Where what we know what that means, if you have a problem yourself, then you shouldn't be trying to take care of someone else's problem before you handle your own. Another abstract I often use to say the grass is not always greener on the other side. And sometimes I say, what does that mean? And they'll say, well, the grass is brown on the other side. Well, we know that's not the meaning. Another time I might say, don't cry over spilled milk. What does that mean? And then they might say, well, you can't drink it anymore. As opposed to, the problem has happened and nothing we can do about it, so let's move on. Those are abstracts. And many times the patient with Alzheimer's disease has a difficult time with abstracts. A change in their mood or the change in their behavior. Very, very common, again, as one of the warning signs that one may be coming down with some type of dementia. And lastly would be a change in their judgment. The judgment such as putting a cup into the microwave with foil over the top of it. Or judgment in putting a paper plate on a burning stove. Judgment in putting a plastic item into the oven. That would be poor judgment. Or spending all the money out of the checking account. Or going out to church at midnight when there's no service going on. That would be poor judgment plus confusion. So these are what we refer to as the 10 warning signs. A person may have one of these, two of these, 10 of these. But if you see your family member, your loved one exhibiting some of these types of things, get them checked out. See a healthcare provider that has some expertise, some specialty in dealing with Alzheimer's disease or dementia of any type. And I think you'll be well served by doing that.